បាទជំរាបសួរទូរទស្សនិកជនជាទីមេត្រីបាទថ្ងៃនេះខ្ញុំធូនីនិងក្រុមការងារបានមកកម្មវិធីមួយនៅទីក្រុង Orange នៅទីក្រុង Garden Grove គឺ County Orange County ដែលហៅថា OC Asian American Cancer Partnership គឺជាក្រុមហ៊ុនមួយដែលគេនាំ organization ជាច្រើនចូលរួមគ្នាហើយនៅក្នុងនោះមាន include ទាំង the Cambodian family គឺជា organization ខ្មែររបស់យើងនៅទីក្រុង Santa Ana ដែលនាំមកដើម្បី encourage ឬក៏ដើម្បីជួយជំរុញប្រជាជនខ្មែរយើងឲ្យមក screen cancer ឲ្យមក check មើល cancer តាំងពីដោះតាំងពីស្បូនតាំងពីថ្លើមគឺទាំងអស់បាទហើយបើសិនជាយើងដឹងមុនយើងនឹងគេនឹងអាចជួយព្យាបាលយើងបានហើយយើងហេតុដូច្នេះយើងសូមឲ្យទូរទស្សនិកជនមេត្តាទស្សនាតទៅនេះបាទសូមអរគុណជួបជម្រាបលា
Are we all ready to get started? Hello everyone, I'm Ellen On, I'm the CEO of KCS and welcome. It's a gloomy day and for you all to sit here, it really is an honor for all of us. Today is not a data report or a lecture. Today is just merely a celebration of our community coming together, the API, the Asian American community, coming together to celebrate something really extraordinary. And thanks to CalOptima, 5 of the leading Asian American organizations have teamed up to launch the Orange County Asian American Cancer Partnership. And so if you will indulge me, I'll give you a 1-minute description on what that is. OCAACP is a multi-cancer, multi-community, and multi-level hub-and-spoke approach that will impact Korean, Vietnamese, Chinese, and Cambodian low-income adults. We plan to streamline community cancer care education, screening, and care coordination through diagnosis, treatment, and survivorship. We expect not only to bridge cancer gaps for the 45,000 folks we already serve, but to expand cancer care access to upwards of 10,000 Medi-Cal patients across diverse linguistic, cultural, and geographic communities. Our goal is to train patient navigators who will educate the community regarding cancer prevention, provide referrals for cancer screening and guidance, and do that through our local Medicaid healthcare system. So we are excited to launch that today, and this doesn't happen through one agency or just with CBOs. It's really a partnership with systems across our county. And so we're here to celebrate together. So we have a lineup of speakers who will share some of their thoughts with all of you. And then we have a wonderful kimbap and spring rolls and other goodies in the back. So before we get started, some housekeeping items. The restroom, this is Southland Integrated's building, which they plan to renovate very soon. But right now, their restrooms are in their clinic side. So if you go towards the back, the staff will help you. We have a guest of honor because without this person and CalOptima, this would not have been possible. So I am thrilled to introduce you to Dr. Pitts, Dr. Richard Pitts, who is the Chief Medical Officer of CalOptima.
Thank you, Ellen. I appreciate it. It's beyond an honor to be here. This is a thrill. The reason it's a thrill is because of the fact that we had this idea about how can we improve screening among 4 specific types of cancers. Why those 4 specific types of cancers? Because they're relatively easy to find. The thrill is to see the idea grow into action and to be here today with all of you to celebrate that action. So people think this is about screening for cancer. It's not. This is about screening for life. And that was not my idea. This came out of a lot of people that I worked with. Here I am, I'm the figurehead, but none of this would have happened without a lot of people's help. I just want to recognize Dr. Richard Lopez. Can you stand up, please, sir? Dr. Lopez was one of the pioneers for liver transplants, published many, many articles, kind of led the country in liver transplant literature, and then also wound up doing very difficult cancer surgeries, pancreatic cancer surgeries, liver surgeries, and such. So he's the real deal. So I just wanted to honor him being here. He's a tremendous partner and helps me. Okay, so moving on. What about these 4 cancers? So 2 of them, all right, so I just say BCCL. It's much easier to remember. So it's breast, cervical, colon, lung cancer. 2 of them are really interesting. And why I say that is because you can cure it before it even starts. And people miss that. We have a problem as people. We get full of fear sometimes. And some people get paralyzed by fear. Fear, and they don't take action. There's a few of us in here that serve in the military. And one of the things that you learn pretty quickly is you're going to be in situations where it might be full of fear. But the thing you do is you channel that fear into action. And that's what you need to do. And all of you here now need to become ambassadors to share with people your culture and your community, your friends and families about the importance of getting screened for these 4 different kinds of cancers. So 2 of them, cervical cancer and colon cancer, are really quite unique in the sense that they all give you warning signs so that you can find the cancer before it turns into cancer. You can treat it. Pap smears. One of the weird things about pap smears is we had a huge surge in doing pap smears because of what? Birth control pills. You couldn't get your birth control pills unless you had your pap smear. And you couldn't get a refill unless you got pap smear. Well, now, there's a lot of different ways to practice birth control. So unfortunately, the rate of pap smears is falling. So critically important to be sure to advocate for people, talk to their doctors about what's needed. Cologuard is a trade name, but that's what it is. It works. And it's kind of funny because some people, and I'm going to use a little bit of vernacular here, it's the poop factor. Nobody wants to touch poop. And so when I was counseling patients, I would say, I'm just curious, have you had children? Well, yes. I said, well, who changed their diapers? And so, that's one of the ways you can break through it and have a little humor. But these tests are really good, and you can get basically cured. If it turns out that you have an indication for a colonoscopy, and all colon cancers start with a polyp, and not all polyps turn into a cancer, but the cancers start from polyp. You just snip it off, you're done. It's when it goes into the wall of the intestine, that's when you get in trouble. And that's avoidable completely. So breast cancer, great news. There's no way to actually do like cervical type stuff and prevent it ahead of time, but early detection. So I was at a meeting and Dr. C.K. was with me at City of Hope, and the cure rate now, 5-year survival is like 99.5%. It's astonishing. Here's a favorite word of mine in English, and it's called ethos, E-T-H-O-S. What is ethos? Okay, anybody here drive to this event? Anybody give it a second thought which side of the road you're going to drive on? You get in your car, and then you go to the right side of the road. I mean, that's just, you don't even think about it. You just do it. And that's the kind of area we need to get to with respect to cancer screening. You don't even think about it, you just simply do it. And it's much easier, it removes a lot of barriers. But again, that is, ethos is how you think about things. And so we need to change how people think about things so they actually don't think about it. It's just something they do. Pretty straightforward. Lung cancer. So lung cancer is, from a medical standpoint, not from a patient standpoint, is interesting in the sense that a low-dose CAT scan in smokers, specifically smokers, that have had more than 20 years of smoking at least 1 pack per day, they're at a high risk to develop lung cancer. And if you do a CT scan, low dose, you have to start at age 50 and do it every single year of your life to reach 80. if you happen to have a spot, we heard a presentation from UCI and other places, you can remove that and it's 100% cure. If you go, so that's called stage 1, it's localized. Well, if you let it go longer, then the rates of cure plummet. So that's why we are looking at those BCCL, 4 types of cancers, relatively easy to detect and take action to get early treatment, and you can then enjoy your life. You can have that grandchild, see that grandchild grow up, you can see your daughter get married, you can have the long planned trip with you and your loved one. This is what it's about life. And we have to change the narrative so that we're all on the same page and we understand that a little bit of fear is fine, but you have to channel it into action. And that's why we're here today. So everybody should leave here. This is sorry. I'm going to write a prescription. Everybody here should ask 5 people they know if they're up to date on their cancer screenings. And because if we don't do that, it's just going to sit here. So just think about that. It's really easy to do, and I will just close with one thought. There's a significant person somewhere, and Dr. CK and I received these pink lab coats from City Folk during the celebration. And I tend to wear it all the time. And I had this epiphany, discovery, self-discovery. On October 31st, I said, this is the end of Breast Cancer Awareness Month. But I said, it's not the end of breast cancer. So I made a promise to myself that wherever I have the opportunity to wear the pink lab coat, I'm going to do it. A lady came up to me about 2 months ago and said, not me, that lab coat is the reason I get my colonoscopy and the reason I got my mammogram. And I was humbled beyond belief. I mean, that's what it's about being a doctor, is influencing people's lives so they don't get sick. And I love these people that say doctors like people who get sick. I would wish I was back in high school. So, but this is really important stuff. So thank you very much for being here. I'm going to give the mic back to Ellen.
Thank you, Dr. Pitt. None of this would be possible through just one agency, because as you all know, the Asian American community is super diverse. We speak a ton of languages, and our cultures are a little different. And so OCAACP is comprised of 5 CBOs. They are the most storied and the most historic in Orange County, and I'm so proud to be working with these folks. So executive directors, come on up. Yeah. Good. Oh, I'm first? Yeah. They tell me what to do. Wearing another hat, which is leading Korean community services. We are a federally qualified health center, so we do the screening, but we're also the largest community-based organization that's Korean-facing. We have some staff here. We run dozens and dozens of programs. I will bore you if I talk about all of them, but for this project, we are the main Korean partner and the lead agency.
Hi everyone, I'm Trisha. I'm the CEO of Southland Integrated Services. I want to give a little history of who we are. So originally in 1979, we were founded by a group of volunteers due to a loss of our Saigon in 1975. So our organization mainly was a refugee resettlement organization. We actually naturalized over 400,000 Vietnamese. In Santa Ana, we were the site for naturalization, and then we did a lot of senior programs and social services. And then late in the 90s, the board decided that we need a health center. So that's how Asian Health Center came on board, and we provide medical and dental during that time. Fast forward to, I joined Southland in 2008. Fast forward, during that time, we didn't have any behavioral health programs or staff, so I wanted to add a one-stop shop for the services. And then in 2017, we changed our name from Vietnamese Community Orange County, which most of you guys know as VNCOC, to Southland Integrated Services, because we want to be inclusive of all ethnic and all the communities we serve. when we come out, a lot of folks says, do you just serve Asian or Vietnamese? We say, we actually serve all people come to our door, but our name just happened because that's how we were found. So when and then we got our FQAC status in 2015, and ever since then we wanted to actually be a one-stop shop for the patient. So as you see here, this building we actually got before COVID, and we hoped in 2 to 3 years, I hope to invite all of you guys back here to have an open house. We're planning to build a 3-story, 45,000 square footage, to do integration that include, mental health, medical, vision, OB, PEDS, specialty, and so that's what we're hoping. So I hope in 2 to 3 years it will become a vision that we can provide services to all the communities that we serve.
Good morning, everyone. My name is Mary Ann Fu, and I'm the Executive Director of OCAACP, Orange County Asian and Pacific Islander Community Alliance. We were started in 1997. We serve about 80,000 people a year in 20 different languages. And this program is so important to us and so key. We started out in healthcare. And one of the reasons why this program is so important for us to be a part of this partnership is I'm 4th generation, but I have 4 aunts and my mother who all have had cancer. And 4 of my aunts had had breast cancer, but they never talked about it. They each went and got surgery on their own without talking to any family member about it. And it was, here are people who've been here since, my family's been here since 1800s, and yet we still were silent about it. And having a program like this that can navigate people to screening, we can get screened earlier, we can find cancers earlier. Having a program that has support, talks about cancer prevention and treatment, and also, that we should be talking about, the latest treatments and just the technologies that we could be doing is so vital to Asian Americans and Pacific Islanders. And so we're just thrilled to be a part of this program. Our navigators are Samantha and Angel are being work on this program, but we all together work in partnership, and all of our staff are working every day together. And so just so proud to be a part of such an amazing collaboration. We're so grateful to Cal Optima for supporting this. Thank you.
Thank you. Good morning. My name is Becky Nguyen, Executive Director at OCAACP. It stands for Vital Access Care Foundation now, but we are and continue to be known as Vietnamese American Cancer Foundation. We were founded by a group of cancer survivors and local physicians who saw there was a need to address the cancer death rates in the community. At that time, it was the highest. Unfortunately, it is still the highest type of cancers, type of death caused in the community in that way. And we believe there's a lack of information, lack of navigation, lack of support for those who are affected by cancer. I just wanted to just share a little bit when Dr. Pittens was saying that there are very few that are truly screenable cancers. Some of the cancer we just happen to bump into. For example, one of our older seniors, volunteers at OCAACP, was recently diagnosed with lung cancer. She doesn't smoke. She doesn't drink. She lost her son not too long ago due to liver cancer. She was coughing at that time when she was caring for her son. And it kept on lingering on. She asked her PCP, should I go get something? And they're like, no, you don't smoke, you don't this, you don't that. So why? Well, what are you worried about? Just, don't worry about it, it will go away. Fast forward a few months afterwards, she went through all sorts of tests. Finally had her CT scan. She is now diagnosed with stage 2 lung cancer. Not smoking doesn't mean that you don't get cancer. So cancer does not discriminate. Rich, poor, young, old, Chinese, Vietnamese, we're not immune. We gotta work together for this. Whatever cancer we can screen, let's do it together. So I want to say thank you to CalOptima for funding our project. And thank you to Ellen for leading this project. She is our hub, and we're all her spokes, just so you know. But thank you. We're in this together, and we'll get through this together. Thank you.
Thank you, Becky. Good morning, everyone. My name is Vatan Appan. I'm the Executive Director of the Cambodian Family Community Center based in Santa Ana. Our organization was founded in 1980 by a group of Cambodian refugees, so we've been providing services to the community for over 44 years, and we have been working in partnership with so many amazing organizations here today for many years as well. We are so excited to be part of this partnership because there are a lot of misinformation in our Cambodian community about, for example, some of you mentioned that, if I get cancer, I will not be able to live longer. I will not be able to live past 1 year. And we want to diss information. If you're able to get screened earlier, that can save your life. And that what we want to get a message out. And part of the goal of the partnership is to increase awareness. And once you have the awareness, what else you have to take action, right? Your action would be to go and get cancer screening, the BCLL, right? That's what I want to repeat from Dr. Richard. Once you get into the screening, a lot of community members have a lot of barriers in accessing the screening, language, being able to call insurance. Am I eligible to get for this screening? Am I okay to go there and talk to my provider? Will my insurance cover? So language barrier is very important in our community. And then the navigation, all those appointments, right? When they get screened and then get a diagnosis, what is the chemotherapy, appointment, who's gonna help me to their transportation. And this program just exactly does that, to be able to help people navigate from point A to point B with the any language support. As you know, our AA and HPI community are so diverse, right? If you come to us like, oh my God, we're gonna get this person and with this Asian language, but no, we speak different languages. But being able to provide in-language personalized support is very key to bring people feel confident to get to the next step. And that is exactly what the partnership is doing. And after the screening, there's so many follow-up appointments, chemotherapy, getting weight, getting to your medication. And that's what we want to support people, to go through all this appointment and follow-up so that they can remain in the care and then they can survive longer, right? Or they can be cancer-free as well. So we are very proud of this because we want to bring this partnership. I want to say the first ever partnership that we bring together. It's so many diverse community in our A and HPI Asian community as well. So again, just want to repeat that we cannot thank enough CalOptima for their support and for the leadership of Korean Community Services and be in partnership with Tricia, Saulan, VAC, Becky, and OCAACP, and so many amazing people here. Without all of your support, we would not be where we are today. So thank you.
Thanks, guys. I see them all the time on multiple projects because these organizations really are key to so many different initiatives in the Asian American community. But we can only do so much as CBOs. We can only do so much as navigators, telling people to get screened. The folks that really get the work done are the physicians. And so I wanted to call up Dr. Kim Yu, who is the Director of Healthcare Strategy at KCS, and Dr. Tuyon, who is the Chief Medical Officer of Southland. As you all know, physicians do the screening, and it is this partnership that is so, I think, unique to this project. So,
Thank you so much, Ellen. And again, my name is Dr. Kim Yu, and it really is a pleasure and an honor to be here celebrating this kickoff for the partnership. I think of many things when I stand here before you. One of them is, this is really personal for each and every one of us. We know family members that have had cancer. My own grandfather died of colon cancer on my father's side. On my mother's side, she had colon cancer diagnosed too late. She ended up having a colostomy for many years. She couldn't go out. She felt embarrassed about the smell, and had she been found earlier, she could have had it treated. And so a couple of months ago, I started having rectal bleeding. And I'll be honest with you, I was really scared. I was like, oh,
my chance of this being something bad is actually pretty high. I've got colon cancer on both sides. So I actually took a few, like maybe a few days before I actually called for the appointment. And I remember my friend who actually did the colonoscopy was like, why did you wait? You could have come like a few weeks ago. And I was like, I just thought it was something easy, right? But it wasn't. And I'm so grateful she did my colonoscopy. They found a polyp. It was benign, but it could have been precancerous. It could have been the precursor. And I'm so grateful that I had that test done. But for each and every one of you, you've got those family members that I know that you care about. Get the screening done. Now, we are so excited that in this partnership, we not only have physicians, we have nurse practitioners, PAs, we have patient navigators, we have this outreach event and many other outreach events that will be happening, outreach coordinators. I want to thank Heather here, who is our amazing coordinator of this event as well, and of the whole partnership. We know all of the people that are involved in putting this event and all the things that will be coming together really is because not only of Cal Optimal support, but because we know that each and every clinician that is caring for you cares for your family deeply. I like to say that family medicine is truly about Ohana. Ohana, if you've seen the movie Lilo and Stitch, right? It says, no one gets left behind or forgotten, right? That's what family is. We're family here now, all of us in this partnership. And so I look forward to working with you and sharing the news. I know that Dr. CK will be giving us lots of statistics, so I'm going to keep it for her to give you all the stats. But know that our rates of cancer are increasing in the AAPI community, and that's why this is so important. So thank you so much.
Thank you so much. My name is Dr. Chuang Nguyen. Welcome all of you come here. Yes, my staff is saying hi to me. I've been with the community, I was talking to Dr. CK since 2002. So it's been a long time. And I've been with Southland for almost 16 years. So as a family doctor, and also as a survivor myself, I will share my story. The first thing is cancer screening. And like Dr. Pitt said, it saves life. Very simple, very plain and simple. So with cancer screening, it does help early detection and early treatment for any cancer. And of course, with our program that we do mammogram to screen for breast cancer, colonoscopy to screen for colon cancer, pap smear for cervical cancer, and of course, with Dr. Pitts mentioned, is the low-dose CAT scan for the lung cancer. And of course, the story of one of the executives sharing is that the lung cancer. So of course, cancer anybody can get cancer. So I will share my story. So as you know, with cancer, sometimes many do not go for the screening due to fear, absolutely, and due to lack of resource and of course cost barriers. So we hope today with the program, with our partnership, that we can make cancer detection, early screening as our priorities to save life. And that's the key thing. It's not just to know cancer, but to save life. So again, thank you so much, Cal Optima, for sponsoring of all the OCAACP, the Orange County Asian American Cancer, from all the things. So as my second part, I will share my story as a cancer survivor. So it was, I remember November 2020. I have Kaiser, so then they called me to do an additional testing for a ultrasound of my breast. So I came there to do an ultrasound, but because they have some free time, they also did a biopsy on that day. And because I'm family doctor and a healthcare, they told me at that moment that I have cancer. It was that evening. And that's just Thursday, I remember. And then on Friday, the next day, they called me to confirm. So the first thing I did was I went up to Trisha, my sister here, said, Trisha, I have cancer. That's all. I let you know that I go back to work. So just like nothing else. So I think that
I think that from my experience, I was lucky it was a stage 2, but somehow that I do my screening every year. I did not miss any. But this nodule or this mass was way so deep that it was close to my chest wall. So there's no way, no how it would have detected. And I remember a year before, I had chest pains. I went to Kaiser, they thought I have pneumothorax, everything, but it turned out at that time, the year before, it was already cancer. That's why it gave me the pain. So luckily, I chose lumpectomy. I did radiation for 1 month. It was only 10 minutes of zap. Then I went back to helping COVID vaccine the same day because they needed somebody to do the vaccine. And so, but to be honest, with the radiation, I had some tattoo because of the radiation. But it took me 2 years for me to raise my arm. It was that much of the pain, and I asked them to say it was just due to the radiation. So yes, I'm very grateful that I survived. The thing that I learned, which I want to share with you, the lesson that I learned, that cancer can change on an individual. It taught me to cherish every moment, to appreciate little things, and never take life for granted. I have learned to take care of myself physically and mentally, except that I fell 5 months ago and broke my knee, which is okay. I still go to work, so I'm still limping. So it's okay. Me and my patient walk in the same place, so it's fine. So lastly, I just want to embrace each day with gratitude. So again, thank you so much for the opportunity to share my story. Because if I can do it, anybody can do it, and I'm looking forward to work with the organization. Thank you so much.
To clarify, I do not abuse her. I cannot tell her to say no. She does not listen to any of us.
This should tell you a little bit about family medicine, community health center physicians. They're a different breed and real heroes in this. And so, and this partnership, it truly is a partnership with the medical community, the community medicine folks in the Asian American community, and the community outreach folks and the navigation folks. But we're all professionals in different ways. The people that really matter in all of this are the lives that we touch and the folks that we actually get screened. And so we have 2 folks from the community, and I know I'm going to butcher this name, Miss Angkiroth Lip from the Cambodian community, and she will need a translator. And then afterwards, Miss Kim Pham, who speaks Vietnamese, does not need a translator. Maybe?
Good morning, everybody.
My name is Angkiroth Lip. ខ្ញុំរស់នៅទីក្រុងសន្តានាតាំងពីឆ្នាំ2010ចាហើយថ្ងៃនេះខ្ញុំមានកិត្តិយសណាស់ដែលបានមកទីនេះហើយខ្ញុំចង់ចែករំលែកបញ្ហាវិសុទ្ធនរបស់ខ្ញុំចា
My name is Angkiroth. I live in Santa Ana since 2010, and today I have the opportunity to share my breast cancer journey.
ខ្ញុំមានកូនស្រីម្នាក់អាយុ11ឆ្នាំ
I am the mother of an 11 years old daughter.
ខ្ញុំជាអ្នកដែលបានឆ្លងកាត់នៅជំងឺមហារីករយៈពេលប្រហែលជា 5-6 ឆ្នាំហើយ
I have been survived the cancer for 5-6 years already.
ជំងឺ cancer ខ្ញុំចាប់ផ្ដើមតាំងពី2017 យ៉ាង 2017
My breast cancer has started since 2017.
ខ្ញុំ មានបានរកឃើញនៅមានដុំតូចមួយដែលនៅក្នុងក្រោមភ្លៀករបស់ខ្ញុំហើយដុំតូចនោះវាតូចខ្លាំងណាស់ដែលខ្ញុំមិនគិតថាខ្ញុំវាបារម្ភចំពោះវាទេពីព្រោះខ្ញុំគិតថាវាតូចខ្លាំង
One day I felt a tiny small lump on me and it was so unnoticeable that I was not really concerned about it.
ខ្ញុំសូមអរគុណដល់សមាគមគ្រួសារខ្មែរ Cambodian Family តែងតែនាំមកនៅកម្មវិធីសិក្សាដល់ដល់នៅចំណេះដឹងដូចជាការរៀនអំពីយល់ដឹងអំពីបុណ្យមករាមសុខភាពផ្សេងៗជាច្រើនដែលធ្វើឲ្យខ្ញុំមានការយល់ដឹងហើយខ្ញុំតែងតែទៅត្រួតពិនិត្យនិងធ្វើបុណ្យមករាមរៀងរាល់ឆ្នាំ
I was so thankful to the cancer screening awareness support from my health navigator at the Cambodian family who continuously encouraged me to do mammograms.
នៅពេលមួយនោះខ្ញុំបានទៅធ្វើ mammogram ហើយខ្ញុំក៏បានដឹងថាខ្ញុំមានមហារីកសុដុំតែខ្ញុំមិនដែលនឹកស្មានសោះថាដុំដ៏តូចមួយនេះអាចប្រែក្លាយទៅជាជំងឺមហារីកចំពោះរូបខ្ញុំ
So one time when I did the mammogram, I found out that I got the breast cancer and I couldn't believe that a small lump lead to breast cancer.
ខ្ញុំមិនដឹងថាត្រូវធ្វើយ៉ាងម៉េចនៅពេលដែលខ្ញុំដឹងថាខ្ញុំកើតមហារីកព្រោះខ្ញុំមិនដែលគិតសោះថាដុំដ៏តូចមួយនេះវាអាចជាទីចាប់ផ្ដើមនៃជំងឺមហារីកហើយខ្ញុំភាសារបស់ខ្ញុំគឺភាសាអង់គ្លេសគឺខ្ញុំចេះតិចតួចដូច្នេះការដែលខ្ញុំទៅពេទ្យឬក៏ស្ដាប់ពេទ្យអីហ្នឹងគឺអត់សូវបានទេហើយពេលហ្នឹងខ្ញុំអត់ដឹងគិតថាខ្ញុំត្រូវធ្វើអីព្រោះអីគឺវាពិបាកមែនតើនៅពេលដែលយើងដឹងថាយើងកើតជំងឺហ្នឹង
I had no idea what to do. My mind went blank. I never thought that a small lump can cause me the cancer and I don't know what to do and to react.
ខ្ញុំក៏នឹកឃើញថាមានតែ Cambodian Family ទេខ្ញុំខលទៅបង្គាងអរគុណអាមីណាយាអែនវឌ្ឍនាលោកវឌ្ឍនាដែលបានជួយយើងខ្ញុំក្នុងការស្វែងរកដំណោះស្រាយអានឹងជួយលើកទឹកចិត្តនៅក្នុងពេលដែលខ្ញុំកំពុងតែមានវិបត្តិជំងឺដ៏ធ្ងន់ធ្ងរនេះ
So I called Bong Kim, one of the health navigator at the Cambodian family, and would like to thank Amina and Watana who helped support me during the time that I had the difficulty.
And also នឹង Sandy ដែលគាត់បានជួយខ្ញុំក្នុងការនាំខ្ញុំទៅពេទ្យបកប្រែជួយធ្វើឯកសារគ្រប់អាចយ៉ាងទាំងអស់នាងប្រៀបដូចជាប្អូនស្រីរបស់ខ្ញុំ
And Sandy is one of the health navigator who helped me out so much. She began taking me to all my appointments. She took me to doctor, chemotherapy appointments, and picked out wigs. And I feel so grateful to her. She's like my little sister now.
អរគុណចំពោះខាលអត់ខ្លួនណាដែលខ្ញុំចូលជា member តាំងពី2013ចាអរគុណមែនទែនចំពោះខាលអត់ខ្លួនណាដែលតែងតែយកចិត្តទុកដាក់ចំពោះពួកយើងដែលមានសុខភាពមិនរឹងមាំជាពិសេសមាន income ដូចថា income low income ដែលតែងតែយកចិត្តទុកដាក់ជួយពួកយើងទាំងអស់ពីចិត្តពីថ្លើមអរគុណច្រើន Thank you doctor.
I would like to thank Carl Optimus, which I have been the member since 2013. They've been taking care of me and would like to thank you so much, doctor.
នៅពេលដែលខ្ញុំទទួលនៅជំងឺមហារីកនេះពេលនោះខ្ញុំគិតថា ព្រោះធម្មតាមនុស្សយើងកាលណាមានជំងឺនឹងហើយមិនដែលគិតថាខ្លួនរស់បានយូរទេ
What I know about the cancer before, I know that you won't live long if you know that the cancer, you have cancer.
ខ្ញុំគិតថាតើខ្ញុំគួរធ្វើយ៉ាងម៉េចពីព្រោះខ្ញុំមានកូនអាយុទៅតែ3ឆ្នាំនៅពេលដែលខ្ញុំកើតជំងឺនោះកូនស្រីខ្ញុំសរិនតាខ្ញុំមានទៅតែមានអាយុ3ឆ្នាំ
I was so worried. I don't know what to do. I only think about my little daughter. She was only 3 years old that time.
នៅពេលដែលខ្ញុំពិបាកចិត្តហើយគិតថាតើខ្ញុំគួរធ្វើយ៉ាងម៉េចបើសិនជាខ្ញុំរស់មិនបានយូរតើកូនស្រីរបស់ខ្ញុំនឹងមានអ្នកណានឹង take care
I was worried who gonna take care of her because if I couldn't live any longer after I had the breast cancer.
ពីព្រោះកាលនោះខ្ញុំមាន stage 3 breast cancer ខ្ញុំនឹងគឺ stage 3
I was in stage 3 breast cancer.
Yeah ដូច្នេះខ្ញុំត្រូវតែពុះពៀគ្រប់ឧបសគ្គគឺដើម្បីឆ្លងកាត់ព្យាបាលជំងឺនេះទោះជាខ្ញុំមានរយៈពេលប៉ុណ្ណាក៏ដោយ
I have to work so hard to get over this difficulty.
Right now ខ្ញុំបានឆ្លងកាត់ដោយជំងឺនេះគឺខ្ញុំអាចរស់រានមានជីវិតបានគឺដោយសារការទៅធ្វើគីម៉ូទាន់ពេលវេលាទៅធ្វើ mammogram
Now I recover because I get to have the mammogram check early enough.
So mammogram គឺមានសារៈសំខាន់មែនទែនដែលអាចធ្វើឲ្យយើងដឹងទាន់ពេលវេលាយើងអាចសម្ពុះជីវិតយើងទាន់ពេលវេលា
So mammogram is really important for me that can save my life.
ដូច្នេះខ្ញុំចង់ផ្ញើចែករំលែកបទពិសោធន៍និងផ្ញើជា message ដល់មនុស្សទៅឲ្យយល់ដឹងអំពី mammogram.
So I would like to share the knowledge about to all the people about the mammogram.
So យើងទាំងអស់គ្នាត្រូវតែទៅធ្វើ mammogram តាមពេលកំណត់របស់ដុកទ័រប្រាប់ដើម្បីអាចជួយជីវិតយើងបាន
We should go to check our breast cancer or do mammogram regularly so the doctor can help us.
អូខេខ្ញុំអរគុណច្រើនដែលបានឲ្យខ្ញុំមកចែករំលែកទៅទីនេះអរគុណច្រើនចាសម្រាប់ការស្ដាប់របស់អ្នកទាំងអស់គ្នាចា
Thank you so much for your time and let me share my story. Thank you.
Thank you. We are so appreciative. It's not easy for a community member to stand up in front of all these folks. So thank you. We have another cancer survivor, Miss Kim Pham from the Vietnamese community, who I hear doesn't need a translator.
Thank you so much, Alan. Good morning, everybody. My name is Kim Pham, and just like Alan said, I am a breast cancer survivor 8 years. When my doctor told me that you have breast cancer, I just felt so shocked, so scared, so lonely. Because in the room there's my doctor, my late husband, and myself. But the first thought come to my mind was mortality. Am I going to die? Who going to take care of my family? My handsome husband is here. And my beautiful children and grandchildren. And I did not share anything, my diagnosis, just like I'm not so brave like Dr. Trian that shared with Trisha right away. I did not tell my boss. I was working with the county at the time as a supervisor of unit of social worker in the program for adult protective services. So as a supervisor, I have the responsibility to my staff, and I'm thinking, if I have cancer, I die, then what will happen to my work, my family, my finance, all kind of questions are just like swirling in my mind, but then the doctor say a lot of things about the treatment, what they are going to do. Then I could not remember anything, things go in here or out at the other side. So, but the only one thing that I, retained until this day, that she said, nobody like to have cancer, nobody wish to have cancer, but if I got cancer and I wish I have the type of cancer that you have. And then it just like, a light went up in my head. I said, wow, this is so positive, and I know that I can survive. And it was very early stage, and the treatment was just so short and sweet. So from the day that I got diagnosed until the day of the treatment end, within 2 months, I went back to work after 2 weeks of, time off. And I did, during the time, I did not share with my family at all. My kids, I did not tell them, I did not tell anybody except for my husband. And then until I broke the news, the kids say, Mom, what happened? Why? And then, at that time, I felt like, not only I didn't do a good service to myself, and also not to my family member as well. So from that point on, until the day that I retired from the county, I told myself I have to, pass on this experience to somebody. And I reached out to Becky before my retirement. So I went, after that, I went to volunteer to VACF just to do volunteer work, talking to cancer patients, lift them up emotionally. And then Becky, would you let me go? No. So I become a staff member of VACF, and we have, the agency promote the cancer survivorship. So we have the cancer support group meeting monthly, patient navigation. Me and my team, we have somebody sitting over there, and we have a team of Vietnamese speaking, Spanish speaking. We have another peer-to-peer supporter at work right now. So we connect to patient, talk to patient almost on the daily basis. We support group, we meet once a month because the staff, I can only work part-time. So we, but the membership for the support group, the participant, the attendance is very steady. We have like more than 20 people, 20, 25, and someday, if we have a good topic, we have like more than 30 people coming to our support group. And I had a social worker from out of the county call me and ask, Kim, did you know there is another person like you in my county? I said, I'm so sorry, I probably not. Because I believe that VACF support group and the patient navigation for Vietnamese speaking patients is the only one right now in Orange County and probably in California. Because we do have patients from our state, calling us to help us, to help us to help them with their family member going through the cancer treatment. So for my case is a very early stage. The doctor said it's stage 0. So that's why I'm just so honored that Becky and allowed me to come here today to participate in the kickoff event, because to me, early screening is life saving. I never missed a mammogram. The year before I was fine. The following year, doctor called me back and want to meet me in person. I said, oh, trouble come. And there it was. But because the early trouble, then treatable, and I survived 8 years now. So I really credit to the early screening. And I wish, a lot of my patients with Khmer, they have that speedy authorization to get that treatment, because I have patients, telling me that I'm still waiting for my surgery. I'm still waiting for the biopsy. I'm still waiting to get the CT scan, because the authorization through Optima taking a little bit long. So I hope that Optima will consider that and help the members, to speed up their authorization process. If that happened, that would be really, really life-saving. And I wish that I did not, speak out of my... You're a social worker. Anyway, last night I made up a song, and I'm going to sing. Oh, no. And my boss agreed, my team encouraged me to sing. So, in Vietnamese, it's called Em Nhắc Quên. And it's written by a very famous singer and songwriter, nhạc sĩ Phạm Duy, But I just made up a song about cancer. Who said cancer is horrid? Cancer is treatable. It depends when you get yours diagnosis. When you get screening early, it can be treated, as long as you listen to your treatment team. When you have questions and don't know who to call, the ACF is always be there to guide you through your cancer journey, so you can keep your peace and love, so you can stay treated in peace. Thank you.
Wow. Thank you. Who knew today's celebration would include entertainment? That was really beautiful. Thank you. Our final speaker, we're almost done. Our final speaker is the Chief Health Officer. Yes, we saved the best for last. The Chief Health Officer from Orange County Healthcare Agency. She is probably super busy with all these public health issues across our entire county. But just to come here and talk to us, she's a part of our community. So I'm thrilled to welcome Dr. Regina Chinsokwon.
Good morning. It's nice to see a full room, and wow, how do I follow that? Yeah, I didn't know Dr. Yu was saying, oh, I'm going to give you all the stats, but I've been told I need to focus on personal background. So first of all, yes, I'm a health officer, I'm a family physician. I saw a lot of patients, saw a lot of my patients go through cancer, and little did I know that I would be a statistic. Some people don't even know this about me. During COVID, I helped with all the vaccination efforts, and then about almost 3 years ago, I had my mammogram, and there was a follow-up from previous mammograms. I've had mammograms, and I was at the age of 43. And at the time, I could have chosen to wait till 45 for a full mammogram, because at the time, I'm low risk. I don't have any family history, no first-degree relatives with breast cancer. I did have a maternal aunt who unfortunately passed away from lung cancer at the age of 49, a non-smoker. I did have relatives who had colorectal cancer. So unfortunately, in the Asian community, cancer is the #1 leading cause of death, women and males. When you think of other cultures, everybody thinks about heart disease, stroke, and it's easy to talk about that, right? How many of you know people who would openly say, yes, I've had cholesterol. Yes, I've had a heart attack. Yes, I have family members with a heart attack or cholesterol or diabetes. But no one wants to talk about cancer in the Asian community. It is the leading cause of death. And we need to be more open about it. There's a lot of stigma. I'm a physician, so I openly ask all my family members what kind of cancers they have. They want to know. And I pursue talking to all of my patients about anything and everything they can do to minimize their risk. I even did that. I tried to have kids at a younger age. I tried to breastfeed them. I was in the military. I exercised. I even did functional medicine, so I certified to learn about lifestyle medicine, and I practiced it. I was doing a lot of really good nutrition. I knew I had to get my 5 servings of vegetables a day, cruciferous vegetables. And there I was, 43, with breast cancer, following a mammogram, what was supposed to be a screening mammogram. And I felt betrayed. How could this happen? I had no symptoms. Yes, I had some lumps here and there. I've always had breast lumps, and I had very dense breast tissue. And at the time, we really didn't know, is it really increase your risk or does it not? Or is it just because when we do a mammogram and you've got very dense tissue, it's just hidden? But now we're finding that women who have very dense breast tissue actually are higher risk of getting breast cancer. So I should technically do it a little bit more frequently. And good news in Orange County, we've got a lot of screening mammograms that are 3D. We have tomosynthesis, which is a little bit better than the 2D mammogram. And that's probably why my breast cancer was diagnosed early. I do have a family member last year who actually passed away from breast cancer. And unfortunately, her family was a little bit more distant. We didn't talk. And she didn't hear my story. And she missed her breast cancer, and unfortunately only had a month to live, and she passed away. We need to talk more about cancers. We need to, it's the leading cause of death. We need to understand what we are at risk for. And I'm Filipina, and everybody said, oh, you can't possibly have cancer. And then there's a stigma, oh, you did this to yourself. No one brought cancer upon themselves, first and foremost. Cellular, there's mutation. We are exposed to a whole lot of things. It's not because of our lifestyles. There's maybe some genetics, but there's treatment, and early treatment can become cancer-free. So I also fell into the trap of one, I'm safe because I'm Asian, I probably won't ever have cancer, and there I was. 2, when I had my diagnosis, then I was fearful of telling my family. Until I found a solution, until I knew what I was going to do. Then I was going to tell my family. But it's hard. It's hard to break the news to your family because then everybody says, wait a minute, if you have it, do I have it? Am I going to have it? But it's good to have that conversation because it's good for them to know what they can do to screen, to save their lives. I am now cancer-free. I did take time off, but I have to admit, as a cancer survivor, sometimes work is distraction. And it's a healthy distraction because that stress is horrible. When you're at home doing absolutely nothing and everybody just wants to talk about your cancer, it's the last thing you want to talk about. You just want to get on with your life. So I know where Dr. One is because I actually begged my own boss, even despite my doctors, I begged my boss to go back to work before I should have. And I just said, I know, but I need this for me. I need that distraction. And I need to spread the word. I need more people to know that cancer can happen to them, but there are solutions. We have a lot of advances in medicine. There's chemotherapy, there's radiation, there's surgery. I actually went through a pretty hefty surgery, and I unfortunately know that even if you get a lumpectomy, I actually had a mastectomy, and I ended up with frozen shoulder, but now I'm back to my yoga, so I'm very happy. But again, we need to talk more about this. And unfortunately, I'm really scared about, so women under the age of 50 in the Asian community are very high. For whatever reason, there's a rise in the risk of lung cancer. And these are non-smoking Asian women. My aunt, over 10 years ago, diagnosed. I was trying to figure out what was going on with her. We need to learn more. We need to follow this science. We need to support our loved ones. And even though we have all these screening recommendations, we need to pay attention to our bodies. and seek care when we have symptoms and demand for appropriate care. If you're concerned that you have cancer, do not let a physician tell you it can't be cancer. Demand for more action, demand to follow it up. My aunt also, symptomatic, oh, you can't possibly have cancer. They missed it, and it was too late. We can follow this up, and I know my patients have taught me well. When my patients came to me with symptoms and they were concerned, we followed it up, even though they're too young for their screening. We followed it up, we did the screening, or we did the diagnostic evaluation and found many times they were right. They had cancer. So we need to pay attention to our bodies, talk to our friends, talk to our community, spread the word so that we can save more lives. And if you do get that diagnosis, yes, tell your friends, tell your family, because they will be there to support you. And it is helpful to always have someone, especially during those treatments, to get through it and to get you through those tough days. If you can't rely on your family or your friends, there is therapists. There are therapists, there are providers that are there to help. I actually went to an oncology psychologist, and actually I thought was helpful because there's too much stigma sometimes with people putting that burden on you that it was your fault. And believe me, I know it's not my fault. And I need everybody else to know that, again, if you're also in that situation and you have that diagnosis, please also seek the mental health to keep your mind healthy through the process. I really thank all of you and really grateful that you are all working together to help get the word out and get more people screened and diagnosed. Okay.
Thank you. We're a little over time, so are there any quick questions? If not, some of us, all of us speakers will be up here somewhere and will be available to answer questions. As we close out, a couple other household items. Southland has created this is gonna sound weird, but it says love, it's a love photo booth in the back, and it's really fun. So please go use that, or you can take photos up here. And then there is food. Before I close out, us executive directors, us chief this, chief that, we actually don't do the work. The people, our community health workers, our navigators, our frontline providers, they're the ones who are the direct contact to our community. And as we celebrate this kickoff, as we launch, we really are building infrastructure for our future. This is more than just one little grant. We hope to have this for the next few decades, as long as the API Asian American community needs it. And so it is the folks that are going to be doing the work on the ground that are the most important to this project. So I'd like to just take a moment to do a big shout out, and if you can stand up as this project launches, that would be great. Physicians, providers, Dr. Chai, I see all of you. Health navigators, Heather. Come on, everyone's shy. Get up. Community health workers. Yeah. Thank you, thank you. Thank you. You guys really are the seed to something that will be amazing, and hopefully something that will be lasting for a very long time, and maybe we can push some of those screening rates up, death rates down. Yeah, definitely. Dr. Pitt says definitely. Thank you all for attending. We appreciate you guys coming to all celebrate with us, and we will be available for Q&A. Thank you very much.
Thank you. ជំរាបសួរ សុខសប្បាយទេទាំងអស់គ្នា I should speak English, right? Okay. Hello, doctor, I guess. And first, can you introduce yourself, please, to our audience there?
I'm Ellen An, Korean Community Services.
I'm Dr. Chai Mies, a family physician at Korean Community Services.
Dr. Regina Chinsia Kwong, family physician and county health officer.
Hi, Dr. Richard Pitts, chief medical officer at Cal Optima.
Thank you. So first, I would like to ask a question to you. Why did you initiate this organization?
We saw a need. The Asian community is growing and it's quite large here in Orange County. and we did not see a comprehensive cancer team addressing cancer issues in the Asian community. So I, along with 4 other Asian organizations, we decided to come together as this partnership.
Thank you.
គាត់ចាប់ផ្ដើមនៅកម្មវិធីនេះឡើងដោយសារមានការខ្វះខាតអំពីការត្រួតពិនិត្យនៅមហារីកផ្សេងៗក្នុងចំណោមបងប្អូនប្រជាជនអាស៊ីយើងហើយដែលកម្មវិធីនេះគឺជួយលើកទឹកចិត្តដល់បងប្អូនប្រជាជនអាស៊ីយើងដើម្បីទៅត្រួតពិនិត្យសុខភាពជាពិសេសការស្វែងរកនៅជំងឺមហារីកផ្សេងៗ
Thank you. And what do you expect to get out of this?
We hope to save lives.
That's good. Thank you.
បាទអ្វីដែលយើងចង់បានពីកម្មវិធីនេះគឺលទ្ធផលគឺការជួយសង្គ្រោះអាយុជីវិតរបស់បងប្អូនប្រជាជនយើង
Thank you. Now my questions go to the doctor.
Yes.
Okay, so what types of cancers out there that people should be aware of?
Well, many of the cancers, the ones we are focusing on, include lung cancer, breast cancer, cervical cancer, and colorectal cancer. Cancers that we can screen for and can treat if caught early.
មហារីកផ្សេងៗដែលយើងគួរតែទៅពិនិត្យនោះគឺមានដូចជាមហារីកសូដន់មហារីកពោះវៀនធំមហារីកសួតនិងមហារីកមាត់ស្បូននឹងគឺជាមហារីកដែលគួរតែបងប្អូនទាំងអស់ទៅត្រួតពិនិត្យជាបន្ទាន់
I don't know this question which direct to the doctor, and if you think you can answer, please answer. The age to go and check for cancer for women or men, what are the age ranges?
Really
So there have been some changes with breast cancer screening, and that's actually starting at the age of 40 for average risk women. And then colorectal cancer also is actually earlier, 45. You start at the age of 45 for colorectal cancer, and that's, again, if you don't have symptoms. If you have symptoms, you should be seeing your doctor earlier. Cervical cancer screening, which is a pap smear, is age 21. What else was it? Lung cancer screening depends. So it's really, if you're a smoker, then you would get a CT scan, and you'd have to talk to your doctor because it's, do you have 20 years of smoking? But again, unfortunately in Asians, there have been some more lung cancers for women. And so if you have symptoms, you should see your doctor sooner and not even worry about the screening. Just see your doctor sooner.
I don't know if he can get all of that.
ចំពោះមហារីកផ្សេងៗដែលយើងធ្វើត្រួតពិនិត្យនោះថាតើនៅអាយុប្រមាណខ្លះដូចជាមហារីកសដន់គឺគេណែនាំឲ្យយើងពិនិត្យនៅអាយុ40ឆ្នាំចំពោះបងប្អូនស្ត្រីដែលគាត់មានអាយុ40ឆ្នាំគាត់គួរតែទៅពិនិត្យជំងឺមហារីកសដន់ហើយចំពោះមហារីកពោះវៀនធំនោះតើបងប្អូនគួរអាយុប្រមាណជាពិសេសផ្នែកបរិសុទ្ធយើងគឺផ្នែកស្ត្រីនេះគឺអាយុ45ប៉ុន្តែលោកស្រីវិជ្ជបណ្ឌិតគាត់បញ្ជាក់ថាកុំគួរចាំដល់អាយុហ្នឹងពេលណាដែលយើងមាននៅរោគសញ្ញាផ្សេងចេញមកផ្សេងដូចជាឃើញដុំគិះអីនៅលើសដន់យើងអីផ្សេងហ្នឹងគួរតែទៅពិនិត្យបន្ទាន់មិនបាច់ចាំបាច់តតែអាយុប៉ុណ្្នឹងទេបាទ
Okay, that's good. One more question for the women. If they're young or if they're old, but they don't have a boyfriend or anything, do they have to go and check for the breast or they have to check for the pap smear?
So it was a little noisy, so I didn't hear the whole question. Could you repeat that?
So the question is, for the woman, does it have to be old to go, or does it have to be a certain age, or let's say that they don't feel anything at all, for they are 40 or 50 or whatever, do they have to go and check for breast cancer? And then for the younger one or the 40 or 30 that they don't have a boyfriend or anything, do they have to go and check for the pap smear?
So great questions. As far as mammograms are concerned, if you fall within the age range to have a mammography, you must do it. It's just like I was saying, you just don't even think about it. You just go and get it done. So it's automatic, okay? It's just like going and get your teeth cleaned. Automatic. You got to go do it, okay? With respect to whether you have a boyfriend or not, it's your history. From the time, and people at some point in time are going to make the decision to have, a sexual relationship with, an opposite sex. If that's the case, you could be exposed to what's called a human papillomavirus, or just simply HPV. The good news, and I'm glad you asked this question, is there is a vaccine that in a very high percentage of the cases can prevent changes in the cervix, the lower portion of the uterus, so you don't ever get cancer. So critically important, they have conversations with their doctors about getting this vaccine. There will be more vaccines coming to prevent other kinds of cancers, but this one's here and now, and it's very effective. So we should get that.
លោកវិជ្ជបណ្ឌិត Dr. Pitt មកពីខាង Akal Optima គាត់មានប្រសាសន៍ថាចំពោះបងប្អូនស្ត្រីយើងទោះបីអាយុចាស់ឬក្មេងក៏ដោយគាត់មានប្រសាសន៍អញ្ចឹងគឺថាទៅពេលដែលគេដល់អាយុដែលត្រូវណែនាំឲ្យទៅធ្វើការពិនិត្យមហារីកសុដន់ហ្នឹងគឺយើងត្រូវតែទៅធ្វើជាពិសេសនៅអាយុប្រហែលជា40ឆ្នាំហ្នឹងប៉ុន្តែដូចគាត់មានប្រសាសន៍អញ្ចឹងបើមានរោគសញ្ញាមានអីយើងគួរទៅមុនហ្នឹងអញ្ចឹងក៏អ្វីដែលជាការណែនាំពីម្ចាស់ហ្នឹងគឺថាដល់អាយុដែលជាការណែនាំរបស់ក្រសួងផ្សេងៗហ្នឹងគឺយើងត្រូវទៅពិនិត្យហើយចំពោះបញ្ហាមួយទៀតដូចជាបញ្ហាមហារីកជំងឺតាមរយៈជំងឺ HVP ហ្នឹងគឺយើងមានវ៉ាក់សាំងចាក់ការពារអញ្ចឹងទោះបីបងប្អូនមានមន្ទិលសង្ស័យយ៉ាងណាការចាក់វ៉ាក់សាំងគឺជួយអាយុជីវិតយើងឲ្យបានច្រើនបំផុតអញ្ចឹងគាត់ថាមានប្រសាសន៍ថាធ្វើម៉េចជួយឲ្យបងប្អូនទាំងអស់លើកតែចិត្តតែចាក់វ៉ាក់សាំងឲ្យបានទាំងអស់គ្នាការពារជំងឺ HVP ហ្នឹង
Thank you. One more question before I let you all go. So the cancer, is it coming from gene, from pass it down from parents and grandparents, or it just happened to a certain people, depend on the weather, depend on the environment, or depend on the pollution and all of that stuff? So who can answer that?
It's a combination of things. It's actually all of that. So it could be genetic. You could be genetically predisposed. And this is where it's really important to understand your family history and those around you, what types of cancers they have and what age. But it also could be lifestyle. It also could be the environmental exposures that you have. But again, we're still learning a lot more about why people are getting cancer at a younger age. So it's really important to keep in touch with your medical team to get more information.
ចំពោះបងគាត់ធូនីគាត់មានប្រសាសន៍សួរថាតើការកើតជំងឺមហារីកហ្នឹងគឺមកពីកត្តាហ្សែនរបស់គ្រួសារយើងឬក៏មកពីកត្តាបរិស្ថានកត្តាការហូបចុកជីវិតរស់នៅរបស់យើងចំពោះលោកស្រីវិជ្ជបណ្ឌិត Dr. CK ដែលមកពីក្រសួងសុខាភិបាលតំបន់ Orange County គាត់មានប្រសាសន៍ថាគឺការបូកបញ្ចូលទាំងអស់គ្នាមានហ្សែនឪពុកម្ដាយប្រវត្តិឪពុកម្ដាយឬក៏ក្រុមគ្រួសារយើងដែលមានប្រវត្តិជាមហារីកនឹងហើយការហូបចុកកត្តាបរិស្ថានកត្តាបំពុលធាតុអាកាសគឺចូលបូករួមទាំងអស់គ្នាធ្វើឲ្យអាចមានលទ្ធភាពនឹងការជំងឺមហារីកប៉ុន្តែអ្វីដែលសំខាន់នោះគឺថាគាត់កំពុងតែស្រាវជ្រាវជាមួយដៃគូសហការផ្សេងៗគឺថាហេតុអីក៏ជាមនុស្សយើងឥឡូវហ្នឹងអាយុក្មេងចាប់ផ្ដើមមានជំងឺមហារីកទៅហើយយើងមិនអាចដឹងមូលហេតុច្បាស់លាស់ទេឥឡូវកំពុងតែទៅធ្វើការស្រាវជ្រាវប៉ុន្តែអ្វីដែលគាត់ធ្វើហ្នឹងគឺថាយើងចាំបាច់ទៅតែតំណាក់តំណងចិត្តសិទ្ធជាមួយវិក្រុមវិជ្ជបណ្ឌិតរបស់យើងបើយើងមានពេទ្យប្រចាំគ្រួសារយើងគួរតែជួបគាត់ឲ្យបានទៀងទាត់ដើម្បីត្រួតពិនិត្យដើម្បីរុករកថាតើយើងអាចនឹងមានលទ្ធភាពទទួលបាននៅមហារីកឬក៏យ៉ាងណាដែរអញ្ចឹងមានតែជួបជាមួយក្រុមថែទាំសុខភាពរបស់យើងដូចជាវិជ្ជបណ្ឌិតប្រចាំគ្រួសារយើងអីផ្សេងៗនឹងបាទ
And as Dr. CK mentioned, there are a lot of factors that go into cancer, including genetics and, unfortunately, just bad luck. But there are a lot of preventable things that we can do. So focusing on lowering your alcohol intake has been shown to lower cancer rates. Smoking as well, lowering your smoking or stopping smoking overall will lower cancer rates. And especially in the Asian population, really talking to your doctor about hepatitis vaccines and screening, as well as H. pylori screening for gastric cancers, which are also very high in Asian populations. And again, as Dr. CK had said, some of these cancers do have a genetic component. So being comfortable and bringing it up to your family members and asking your family members about cancers that run in your family is also very important for prevention.
Dr. Chai មកពី Korean Community Service Clinic គាត់មានប្រសាសន៍ដែរដូចគាត់មានអញ្ចឹងគឺថាគឺជាកត្តាគួបផ្សំទាំងអស់គ្នាមានកត្តាហ្សែនកត្តាធម្មជាតិហើយនិងកត្តាបរិស្ថានជុំវិញអ្វីដែលសំខាន់បំផុតហ្នឹងគឺយើងកាត់បន្ថយថាតើមានវិធីសាស្ត្រដើម្បីការពារកុំឲ្យមានគេថាការពារប្រសើរជាងព្យាបាលគឺថាមិនការពារដូចជាការមិនហូបស្រាឬក៏ពិសាសូរ៉ាច្រើនទៅកាត់បន្ថយឬក៏កំសាយអសោះការមិនជក់បារីបាទកាត់ឬក៏កាត់បន្ថយការជក់បារី រីអញ្ចឹងហើយគាត់មានប្រសាសន៍លើកទឹកចិត្តឲ្យយើងគឺថាវិធីសាស្ត្រណាដែលអាចជួយការវិធាការពារកាត់បន្ថយគ្រោះថ្នាក់ផ្សេងរបស់យើងហើយឥឡូវនេះអ្វីដែលគាត់កំពុងតែបារម្ភហ្នឹងគឺថាក្នុងសហគមន៍អាស៊ីរបស់យើងហ្នឹងការត្រួតពិនិត្យផ្នែកជំងឺថ្លើមក៏មានការថយចុះដែរអញ្ចឹងគាត់សូមលើកទឹកចិត្តឲ្យបងប្អូនពិភាក្សាជាមួយក្រុមគ្រួសារតើមានប្រវត្តិក្រុមគ្រួសារដែលមានជំងឺថ្លើមហើយបើមិនថាមានឬក៏អត់មានទេយើងអាចពិភាក្សាជាមួយគ្រូពេទ្យទៅធ្វើវិធានការខ្លះដើម្បីការពារនៅជំងឺថ្លើមរបស់ហ្នឹងបាទ
Do you have anything to add? Anything to add? No.
Get screened.
បាទលោកស្រីអាឡឹងគាត់ថាកុំភ្លេចទៅទទួលការធ្វើត្រួតពិនិត្យអំពីមហារីកផ្សេងណាបាទ Great Screen
So the bottom line for today's event is to encourage people to go screening early so you can detect the cancer early and that way you can get cure because when it's in the beginning stage you can cure but once you are in the higher stage which is I believe stage 4 then it's very difficult to cure. They're still possible but they're very difficult so almost zero chances so that way you got to do it early. The early is the better.
អញ្ចឹងគឺថាសំខាន់បំផុតសាររបស់យើងក្នុងកម្មវិធីថ្ងៃនេះគឺធ្វើមិនលើកទឹកចិត្តឲ្យបងប្អូនក្នុងសហគមន៍របស់យើងគឺត្រូវត្រួតពិនិត្យសុខភាពជាពិសេសការត្រួតពិនិត្យអំពីជំងឺមហារីកផ្សេងហ្នឹងឲ្យបានឆាប់បំផុតពេលណាយើងចាប់បានបំផុតគឺថាយើងចាប់ផ្ដើមរោគមេរោគហ្នឹងលឿនយើងការពារព្យាបាលបានលឿនដែរអញ្ចឹងអាយុជីវិតយើងកាន់តែរស់នៅប្រសើរដែរ But I want to mention again Dr. Pet is BCCL is breast cancer, colon cancer, cervical cancer and lung cancer អញ្ចឹងលោកដុកទ័រពេទ្យនិងដុកទ័រវិជ្ជាផ្សេងក៏លើកទឹកចិត្តគឺការពិនិត្យនៅរោគជំងឺមហារីក4ដែលជាចម្បងហ្នឹងគឺទី1ជំងឺមហារីកសូដន់ទី2 colon cancer ជំងឺមហារីកពោះវៀនធំទី3គឺ cervical cancer ជំងឺមហារីកមាត់ស្បូននិងទី4 lung cancer មហារីកសួតអញ្ចឹងគឺមហារីកទាំងអស់នេះហើយដែលធ្វើបង្កឲ្យគ្រោះថ្នាក់ដល់ជីវិតប៉ុន្តែបើយើងទៅត្រួតពិនិត្យរោគជំងឺមហារីកនេះគឺថា screen វាបានលឿនបំផុតគឺជួយអាយុជីវិតយើងបាទសូមអរគុណបងប្អូនទាំងអស់គ្នាបាទ
អរគុណ Thank you very much Thank you so much Thank you បាទជំរាបសួរបាទទូរទស្សន៍ខ្ញុំបានជ្រាបហើយឃើញហើយថាដុកទ័រទាំងអស់បាទជំរុញយើងទាំងអស់គ្នាឲ្យទៅ check cancer បាទ check បាន early អានឹងយើងគេនឹងជួយជីវិតយើងបានបាទជីវិតរបស់ផងយើងទេមិនមែនជីវិតរបស់ផងគេទេបាទហើយហេតុដូច្នេះសូមអញ្ជើញមកចូលរួម check cancer ដោះសដន់ឬនឹងសួតបាទសូមអរគុណសូមអរគុណសូមជម្រាបលា